So today, for our weekly webinar series, we have Dr. Linda Fahey, who's Chief Nurse with the American Red Cross. She's doing a presentation on nurses responding when disaster strikes. Dr. Leahy, I'm allowing you to have it.
Absolutely. Thank you so much for inviting me to speak with you. As she said, I'm Linda Fahey. I'm the chief nurse of the American Red Cross, but I'm also a nurse in Arkansas. I live in Northwest Arkansas. I graduated from University of Central Arkansas many years ago and have had a long career where I completed my master's degree in Loma Linda University in California and a doctoral degree at the University of Illinois in Chicago. Many different jobs over my career, but some of those were teaching jobs at universities, but most were in hospital practice and with progressive jobs up to chief nursing officer in a hospital. And then I thought I retired. Instead, I got involved with the American Red Cross and now have the honor and to do one of the most amazing jobs that I've had in my whole career, and that's to lead a group of nurses and other health professionals delivering care in conjunction with the American Red Cross. I'd like to spend some time telling you about the American Red Cross and then talking to you about what nurses do with the Red Cross. Next slide. Who is American Red Cross? Well, we were founded in 1881. We're part of an international Red Cross movement. So across the world, all of those Red Cross organizations you hear mentioned on the news are all part of the same movement. We're governed by volunteers. 90% of our workforce is volunteers. And almost everybody that I work with in nursing and health is a volunteer. The American Red Cross serves all Americans, regardless of nationality, race, religion, citizenship. We don't care. We're here to serve people. 90 cents of every dollar that we collect in donations goes directly to helping people in need. Next. It's interesting within organizations what your whole organization is based on. And across the globe, the Red Cross sticks with some fundamental principles of humanitarianism, humanity, impartiality, neutrality, independence, voluntary service, unity, and universality. When you look at all of the definitions and all of the things that are encompassed here, it means that we don't take political sides. We are not a government agency. We are completely focused on serving people in need in areas across the country. We do have some relationship with the United States government because each Red Cross across the world has a charter from their government, and there can only be one Red Cross in any country. So there are not competing Red Crosses across the United States, one Red Cross. And we do have a charter to provide service and support to the U.S. military, especially to their families, and when disaster hits, to meet the needs and help the military respond and keep their families informed. So we do have a government job in that regard, but we don't receive funding from the government, and all of our funding is from donor dollars. Next. So what do? We have a number of business lines. We provide support on international services, and one of our focuses there is we have a measles, mumps, and rubella initiative where we help give vaccines to children across the world in countries that request our assistance. We also advocate and educate for funding to support that initiative at the international level. So we are involved in some cases advocating for that. We provide services to the armed forces, and we actually do have nurses working as volunteers in military treatment facilities across the world. Many of those are spouses who travel with their spouse to a military base, maybe an overseas duty, and they're allowed to continue practicing as a volunteer in those hospitals. It's a great service for both the hospitals and for the military the spouses who respond there. But we also have opportunities for that within the main part of the United States as well. We provide training services. You may have heard of Red Cross First Aid, water safety. All of those are services that are provided by our training services. There are opportunities to get continuing education by logging into the American Red Cross Training Services website, and we actually have CPR courses that you can take that are with similar content to the American Heart Association. And then biomedical services, many of you who work in hospitals are familiar with that. Red Cross provides at about 40% of the nation's blood across the United States. And we have apheresis services in many places across the United States with employed nurses who work there. But what I want to focus on is right there in the middle, disaster relief, and what nurses do with disaster relief. Next. First, let's talk about disasters. And sometimes morning report that I attend for a disaster report off sounds a little bit like a sci-fi movie where there's disasters happening across the country and each one pops out and it gets a little bit worse. We have a trend for ongoing and increasing disasters. And this month has been no different than several preceding. We have had major disasters, what we call level 4s and 5s, where people's homes are destroyed, people's lives are disrupted, and people need shelter. And we have several right now ongoing across the United States. There's a growing trend for billion-dollar disasters, and those could be drought, hail, flooding, hurricane, tornadoes, wildfires. Watch the EV news, and you see all of those happening right now in the United States. Next. But look at this trend. The number of annual billion-dollar disasters occurring in the United States has increased tremendously. Look at the numbers in 2025 compared to 1980. This is a trend that we believe is strongly related to climate change and weather changes that are happening across the country, but also related to where the populations are growing. They tend to be growing in some of the places that are disaster prone. So you multiply an increasing number of weather-related disasters and populations growing into disaster prone areas, and this is what you get. This is from Climate Central. You can get a lot of data from that website, and I've only picked a few for you to take a look at. The other thing that's happening is there's less time between disasters. We have only a few days. You can see there's very few gaps in here of time between disasters. Big disasters are happening all the time. And as I mentioned today, we have a disaster, a fairly large one, still ongoing in Spokane, Washington, and that's for fires. We have a smaller one that just wrapped up in Wisconsin. We have disaster ongoing in Indiana. You've seen the reports for electricity being off in Gary, Indiana, from the storms that went through there. I believe we have one in Ohio right now from flooding. We have a disaster in Hawaii because the typhoon that came close to the islands in Hawaii last week. We have a major disaster with a very large shelter right now in Reno, Nevada, because of a wildfire there. And we've responded twice even to Guam and the islands near Guam this year because two major high level typhoons hit those islands. And that's part of the territories that we cover as the American Red Cross. So lots of opportunities. In Arkansas, all of you know that tornadoes hit us randomly, and we respond to tornado disasters. The first disaster I ever responded to as a Red Cross nurse was the Little Rock tornado that hit just about 3 years ago. Next. So part of the way that we respond is we put people on airplanes and we fly them to disasters, and we have a whole system that responds to disasters across the country when the need arises. But that's not the best way to respond, and we are trying to change the way that we look at the work that Red Cross does. Our greatest opportunity to build both internal and external capacity is to mobilize communities to better care for themselves. We have the infrastructure, we can move supplies, we know how to set up shelters, and we know how to jump into disasters. But what we are building now is the community, the human capacity to make it real at the local level. And when I'm talking about local level, I'm talking about the Arkansas Nurses Association nurses responding to disasters in their communities. We know that the nurses who live in those communities are the best ones to respond to a disaster because they know their communities. They know the people who may be going to our shelters, and they know the resources in the communities. When I fly in, I don't necessarily know those things and have to learn, and I can't get there right when the disaster hits. You live there. We all live in Arkansas, and learning to respond in our communities is the best way for us to move forward in the future. So this is our practice setting, and it's unique. And not all of the people occupying these cots are actually needing health services from a nurse, but the eyes and ears that walk through this area are needed for every single client that's there. You can think about our expertise on infection control. You can think about our expertise on just seeing somebody and knowing that they need help. Think about this as I talk about what we do. First, our disaster health services program is a health profession-led interprofessional model of community-based care. We bring nurses, physicians, and other healthcare professionals all together to support the clients and really also to support the workforce who is there taking care of the clients, because we provide the staff health for those particular volunteers when they come to respond to a shelter. Next. This is who we are. We have about 3,000 disaster health services health responders. About 2,000 of those are registered nurses, and then a sundry of others, 94 nurse practitioners, and 125 physicians. EMTs are a special part of the group that responds. And we work together to provide the model of care that I'm going to talk about. Next. First, why? Our purpose is to stabilize and meet immediate disaster-related health needs, and really to facilitate referrals to healthcare at higher levels of healthcare, to make sure that the people who have lost everything don't lose their health too. And people forget about health when they're trying to make sure that their family is safe and figuring out where they're going to sleep tonight. Our job is to help them sort through that part of their lives, stay on track so that it does not become an issue as they try to recover. We reduce suffering, we help prevent or lessen both acute and chronic health needs, and really also try to ease the strain on local community health resources. Our goal is to keep people out of the emergency department if we can, but we don't provide emergency level care. We provide community-based care, and I'll talk a little bit more, give you some examples of that. As we provide care, we do internal referrals. We work with a full team of others to help provide the care. We have mental health workers, and some of our mental health workers are nurses. So if you have experience and you're a psych nurse, if you're an advanced practice nurse in mental health, we would love to have you working in that area with us. We also have disaster spiritual care, and we have disability integration with our team, and we have case workers who help us work with the clients to figure out next steps because they can't live in a shelter forever and they need help understanding this whole system of recovery. And that's what our caseworkers do. Next. So Disaster Health Services, DHS, we like acronyms probably more than any healthcare provider that you've experienced, but we do assessment, triage, and stabilization. So we're there when that shelter opens. We take a look, we decide who can't stay in the shelter and need a higher level of accommodations to be able to be safe in our post-disaster environment. We'll do triage, we'll communicate with our disaster folks and help make the best decisions possible for where people stay. And then we try to triage who's in trouble, who can wait, how do we work on making sure our population is stabilized, and that stabilization can include a lot of different things. Medication and health equipment replacement. The Red Cross provides us as Red Cross nurses $500 per client access, immediate access, our decision on being able to replace medications and health equipment for that for each client to keep them on the right track. And so we start trying to get those medications replaced immediately. We work with pharmacists on a number of things on what will insurance cover, can we get emergency replacement. We reach out to health DME providers to get equipment replaced. We work with our disability folks on accommodations in the shelter. And then we take a look at preventive and wellness support. We really need to keep people well in our shelters. And so infection prevention is a key duty of disaster health services. We also try to make sure that there's places for activity that the environment, the challenging environment that I showed you to start with, supports wellness activities. We do care coordination and advocacy. So we may be talking to you if you're in a hospital emergency department, talking to you about a client that we're going to be sending over. We may be asking you to share information so that we can get medications replaced. If you're in a doctor's office, we may be reaching out to you and asking for some advice on how to help this client. And we will be advocating with the Red Cross and with other healthcare providers to get the best that we can for the clients that we're serving. I did mention that we do health surveillance, both in the shelter and with our volunteers to make sure that they're staying safe. And when a shelter worker notices something, doesn't know how to deal with it, we do clinical consultation. So when somebody asks us for help on a disaster, we provide that help. And of course, we do documentation and reporting, and we have our systems just like everybody else. Next. So what's different about disaster health services compared to what you do in a traditional clinical practice setting? In office or clinic-based setting, or telehealth, when indicated, it's all of that is different. That is where you provide care. Usually the client comes to you, right? Well, we provide care wherever they need, and that's at shelters, fire sites, evacuation centers, and sometimes walking down the street in a disaster hit area. You provide and continue to have ongoing therapeutic relationships with your patients. Our relationships are short-term, immediate health needs, stabilization. And so our goal is that they only need our help for a little while because we're going to help them stabilize and take care of themselves. You assess, diagnose, and treat health conditions. We assess, stabilize, and connect. So we do not make medical diagnosis. Our doctors and our advanced practice nurses use their advanced assessment skills in dealing with our clients, but they cannot diagnose, prescribe, or do procedures. And you're focused on long-term health issues and functioning. We're focused on 72 hours, a very different focus unless you work in the emergency department. Uh, you medication manage within an existing care plan. We medication manage in a health system ecosystem. And then we have shift-based care. Our major deployments can change. And we have to build connections in real time in unfamiliar communities, usually to provide care to our clients. Next. I said we provide home fire help. We usually do that virtually. And this is just an example of somebody who had a home fire and was impacted by it. And that's a middle-aged guy that they represent our middle-aged adults represent our largest client base. The males are 55 to 57% of our clients. We do have a high aging population, and those tend to be high fatalities. But when a fire hits, then we do assessment, triage, and stabilization, but usually virtually, and that's an individual home fire. If a client loses health care items or has healthcare needs after a home fire, we call that client, we assess virtually, and we work with them on making sure their healthcare needs are met. And so Sean would be a typical client for us on a home fire. And we would probably deal with that client for about 4 days, get those items addressed, get those items replaced, and then Sean would be more prepared to handle the tragedy that he faces with a home that's burned down. Next. Now, James, another one. This is a shelter client. And these are clients that come when we open a shelter. There's usually a disaster that's hit, whether it's a small one, a tornado, a multi-family apartment that has is no longer can be occupied because of damage from fire, or a major disaster like a hurricane that hits along the coast, or a tornado that tears through the middle of your state in a highly populated area like Little Rock. So most of our shelter victims are low income, rent burdened households because those are the ones who don't have the resources to pay for a hotel if disaster hits, or don't have an insurance policy that is kicking in yet, where their insurance and homeowners insurance is paying for temporary housing. So those are often some of our residents, mobile home residents, just because their homes are more at risk on disasters. Children, elderly, single parent households who don't know where to go. You can see all down the list. It really is about anybody can end up in the shelter. And what do we do again? Assess, triage, and stabilize. That's when the shelter opens, we try to have a nurse there, or a doctor, or an advanced practice nurse to work with the shelter staff as people walk in the door to take care of them. And we do things like deciding where they're going to sleep in the shelter. You know, as they walk in and they're on oxygen or CPAP, then they need to be near a plug. And as you saw the shelter picture, it might not be near a plug. So I go along and start putting signs up reserved for health services right when the shelter is opening so that they know where I expect to be able to put people who have health needs. We do preventive care, wellness, care coordination, all of the things I talked about. And that will happen over um, maybe 2 weeks. We hope to get most of the needs met for James. But sometimes it's ongoing monitoring for longer, maybe a month in the shelter. But usually we are, by about a month, we're trying to help our shelter clients move to a more permanent solution. So just a great example of what that might look like. Next. Now, regional or local opportunities for response are tremendous. And remember, I said our focus is local response. We are trying to get you involved with your community, and we hope to be able to give you the training that you need to jump on board with us, even if it's just for that one disaster that hits your community. I know that most nurses want to help when that disaster hits their hometown. I also know that many don't know what to do or how to get started. You know how to get started if you're called in and activated within your hospital, but what do you do when your whole community is laying in shambles? Well, we respond to single and multifamily house fires, small scale natural disasters. We might support in person, but sometimes we support virtually. And we often have shift schedules so that if you are trained and participating with us as a volunteer, and this happened in your town, and you're off on Tuesday, you can sign up to help in the shelter on Tuesday. We do also get involved in preparedness and training of our communities. We do disaster health planning drills, exercises, and we provide training and have training materials for groups to work with school districts, for groups to help us install smoke detectors in homes. We do that for free, and it's a great project for a group, maybe a chapter of the Arkansas Nurses Association. And then every disaster is a little bit different. So we encourage you to find out more from your local chapter on how they respond. In Northwest Arkansas, we have a great team, and I'm the disaster health services lead for this area, always willing to talk to you about disaster and how you can help. Next. Now we have national responses, and those are the ones that make the news. You deploy in person. If you're deploying and getting on an airplane with the Red Cross pays for transportation. For all of our volunteers, we cover malpractice. But typically, our deployment when you travel is 10 to 14 days. And we do travel, we do accommodations, we provide meals. And so your expenses are covered. And our work environment is you're assigned to a service delivery site. That might be a shelter, it might be a multi-agency resource center. It could be, as I said, right in the middle of the disaster area, meeting with clients and families as you walk down the street with an interdisciplinary team. You go where the clients are. We provide face-to-face interactions, connect with local resources, and offer training and support to our communities through Health Liaison. We can deploy virtually, and many times we do that over the phone to support those who are calling in and who need help with that can be handled virtually. So that's our national response, and that's I just returned from a response to Wisconsin. It was a small tornado, but 250 homes were damaged and another 27 were destroyed there. So you can imagine that a pretty large swath of a community had been impacted. We had a shelter, and we also did intake where we met clients who would walk in and talk to us about their needs, and we would help them both with suggestions, referrals, and financial assistance. Next. So how do you become a Red Cross volunteer? And what are the steps? Uh, We assume that registered nurses already know how to do this job. You know what to look for, you know how to change a dressing, you know what infection looks like, you know how to talk to clients. Those are skills that we have as nurses, and we don't train you to be a nurse, but we do train you to understand how to respond within an emergency Red Cross structure. And that training is primarily self-directed. Um, and in order to be able to deploy, you have to complete about 10 hours of self-directed learning. Not very much, considering that this is a whole new practice area for you. You must have an active unencumbered license, and we do require basic life support certification, but we provide that through the American Red Cross training services. So that's free if you become a volunteer with the Red Cross. We that training, we support you through that training, and when you finish, then you have an opportunity to do some virtual work with us to get more comfortable with our documentation system, and can decide if you want to just respond to your local neighborhood, if you just want to respond in Arkansas, if you just want to respond in a four-county area, you get to decide. Nobody says you have to get on a plane tomorrow and fly away. Many people can't do that, but some want to. And we encourage all of those options, because with that rising trend of disasters in our communities, in our state, in our region, which includes both Missouri and Arkansas, and across the country, we need nurses on site. We need nurses in their communities to respond with us and step in. We are developing an option where the 10 hours is not required, but that as a group, the Arkansas Nurses Association or others can step into us part way, so that we can provide a 2-hour continuing education course that teaches you a little bit more. I've just brushed the surface of what we do, but teaches you a little bit more about how we respond and what you would do if you were to walk into a shelter with us as a partner organization. And we'd be glad to discuss that with you more. If you have questions about about the information that I've presented to you, reach out at our email address. That's redcrossnurse@redcross.org, or simply send me an email, linda.fahey@redcross.org, and I'll answer those questions for you. We'd love for you to become a volunteer, and I've provided a link here, or you can just go to redcross.org on the web, and there's a place that says volunteer. You start signing up, and we will reach out to you and usher you through that process. We would love to have you. Remember, we're one of the major safety net organizations in the United States for disasters, and 90% of the Red Cross is volunteers. 90% of what you see on the ground, helping people and practicing in the most rewarding practice I can say that you will ever see. You have the opportunity to do that with us in the Red Cross. I tell people that that I'm offering you a job. Unfortunately, the pay is not real high, but the rewards are many, and we'd love to have you. I'm open to any questions as you move forward, and I hope that if you watch this virtually, that you'll reach out and ask those questions. We need you. We hope you would have a rewarding experience with us, so I invite you to join us. Thank you.